Bama and Hot Country Hits 99.9. She is with us, Ellen Plummer. Ellen, good morning to you from West Michigan Community Mental Health.
Good morning.
Hey, it is kind of well, it's a new year for sure, but it is a pretty cool opportunity for the community to get even better healthcare services. I don't even know how we can get there, but because all of the initiatives that CMH has been doing, but you do have something incredible that we can share with the audience this morning. So looking forward to talking to you about that. Here, both on air and online. Ellen Plummer, the Chief Healthcare Integration Officer at West Michigan Community Mental Health. This thing called Behavior Health Urgent Care. What is
Yes.
that all about? Take us through it.
Sure. So, as part of the state of Michigan's drive to ensure that we have comprehensive behavioral health response in all of our counties, including our rural counties, part of what is being implemented is behavioral health urgent care. So you can think of it very much like an urgent care you would go to for medical, physical health needs. Same concept. We just address urgent behavioral health and substance use disorder emergencies that don't require the level of an emergency department. So again, you go to the urgent care when you don't need to go to the emergency department. For your physical health, it's the same concept. So we are able to provide immediate de-escalation, risk assessment. We'll be able to provide short, brief solution therapy to kind of resolve any crisis situation. And so it's very much the urgent care concept around behavioral health and substance use disorder treatment.
And I'd love for you to give us kind of an example here in a few minutes. But so it sounds like there's maybe 3 levels of care at this point when you bring in the behavioral health urgent care. And tell me if I'm wrong in this, or if we need to tweak it a little bit. But you have the hospital visit emergency care. That is that's on its separate tier. You have the walk-in or the phone call. We talk about the 24-hour line where somebody is able to call, but now there's kind of that middle. Can you separate or give us even more of an example of each level, if that's fair to ask
Sure.
you this morning?
Sure. So, best practice standards came out from the federal SAMHSA organization regarding crisis response for behavioral health. And they have put things into 3 categories. So, initially, we want someone to contact. So, that would be calling the crisis line, calling 988. That's that aspect. The next level is someone to respond. So that would be our 24/7 mobile crisis response, our community outreach, those types of things. And then a safe place to go is the third level of the crisis continuum, and that includes the behavioral health urgent care as some place to go. It would also include if we had to look at putting someone in crisis residential or inpatient kind of thing. So those are the 3 tiers and kind of the way that they go in terms of what may be needed. So least restrictive is just someone to talk to, so you call, all the way up to a safe place to go.
And in your personal opinion, and others around you there at CMH, this sounds like it was needed. I would assume there were enough situations that this wasn't just coming from an outside government agency, that
Right.
you had good conversations internally as well.
Oh, definitely. We know that we have limited resources, and because of our rural nature and the size of our communities, we all have to work together with our healthcare system and other agencies and other community partners. And this is really a means to also get people into service or access their services and needs quicker. Right now, for us, our closest any type of inpatient unit is Muskegon, and then crisis residential is Grand Rapids. So for people in our community, this is a way to be able to stay local, get help they need, and we also will be working with our community partners to ensure that we're all using our resources as efficiently as we can. We're not having people have to wait in the emergency department or that don't need to be there because they can walk into our urgent care and be seen and assessed.
This is great. The team feels pretty good about this move. Take us through some of the internal conversations, or at least comments.
Sure. So this is this is a really exciting adventure we're going on, I would say. We have really been honing and evaluating and crafting and changing our CSS model, our crisis stabilization services model, over the past several years. And this is kind of really one of those last pieces of what we didn't have, which is a place to go, which was really having really great evidence-based practices that we can apply to individuals that come in with a behavioral health crisis. So teams are very excited. I think it's a great opportunity for our communities. It will be a great service. It will, again, it's really about getting people the help they need when they need it and not having to figure out how to get someone somewhere or this, that, and the next, and having people be able to receive services in their community.
Absolutely. And we're going to talk over the next couple minutes about who can actually benefit from this service, location. We'll talk about
Yes.
hours as well. But if you're just joining us both on air and online, we're talking with Ellen Plummer. She's the Chief Healthcare Integration Officer at West Michigan Community Mental Health. So let me bring up that question. Who can benefit from this? Who can utilize this service?
Technically, anyone can come and utilize the service. So we have, at this time, our brick and mortar or our physical location is our Ludington office, which is at 920 Diana Street in Ludington. And we have a separate entrance as well for the behavioral health urgent care if you come to the Ludington office during those hours of operation. So it's the east entrance in our building, and there are signs and everything. So there's dedicated parking spots on the east side of the building and everything. But also, we can provide BHUC services virtually. So if someone walks into our Hart office, let's say, we can get them connected virtually via video to clinicians that are in the Ludington BHUC, and they can still receive the same type of service. It would just be virtual. Technically, though, anyone can walk in, anyone can contact us, anyone can access the service, and we will address the situation according to what we evaluate and then also what the needs are.
And I think it's so important for those, in Oceana County, in the Hart area. And that's the telehealth aspect of it, right?
Correct.
And that's really kind of exploded in the last few years to be able to give that virtual healthcare checkup, that conversation one-on-one in real time.
Right.
Do you think that a lot of people have been able to gravitate towards that, or even now are more comfortable with telehealth?
Oh, I would say definitely. I think both, staff that do that work plus individuals that is how they're receiving treatment. Yeah, I mean, over the last 5, 6 years, it's really just become much more status quo and really been determined just as effective as opposed to being, face to face kind of thing.
Yeah.
So,
We're talking, if you're just joining in on the conversation, we're talking about West Michigan Community Mental Health and the behavioral health urgent care. This is open now, or is it going to be open in a few days? Where are we at on that?
so it is currently open. In November, we did what we refer to as a soft launch. So we weren't at our full capacity of hours and everything, but we are currently operating at our standard business, like what our BHUC hours will be. And that is Monday, Wednesday, Thursday, Friday, Saturday, 9 a.m. to 4 p.m. And then Tuesday hours are 9 a.m. to 6 p.m. So that is the behavioral health urgent care hours, but we always will still have crisis services available 24/7, 365. So,
Yeah. And we talked a couple of minutes ago about telehealth, and I want to make sure that we don't error in this, is that you have services in the Baldwin area in Lake County,
correct.
and you can telehealth there as well, even though the physical location in Ludington is open for walk-in, both Oceana County and Lake County can be served with this new initiative.
Correct, yes. We would have individuals can walk into either of those offices. Individuals could also be sitting in their homes, and if they have, smartphone or whatever, contact our number and say, I, need to speak to someone, and we can set up virtual visits that way too. So it's coming into one of our offices or accessing it even from their own home.
Wow, technology serving the community for sure. Just so that we're clear for the listeners and viewers this morning, I'd like to kind of go down some of the services or the
Sure.
examples that if somebody needs this particular service, the behavioral health urgent care, walk us through that if you don't mind.
Sure. So how the process will work or what someone should expect. I'll use an example of someone walking into our Ludington office and saying, I, feel like I'm depressed. I don't feel good about myself. I'm having thoughts of harming myself, etc. What we do then is we have what we're calling triaging. So we will have some preliminary questions and conversation to determine what the next step may be for this individual. And again, that's the immediate assessment, evaluation opportunities. We have the option to develop safety plans, do risk assessments. We will refer to the emergency department if needed, if it's beyond, something medically that's not appropriate for us to handle, those sorts of things. We also will be able to provide, if after we evaluate the situation, if they just need to get open to services and get started, we'll be able to provide that intake assessment right at that time, and they will get open to services. And also, we will be able to provide some pieces around medical screenings as well as medication management. We have, there is nursing is available, consultation is available during BHUC hours, as well as we have a psychiatrist on call as well, who can prescribe meds, start people on meds, address if there's a current individual that's getting services that's maybe having a med issue, they can address that during that as well. So it's really kind of, again, it's not urgent, emergent, like really high risk situations, but we can do a lot of things that we can not have people have to go further or to other places. They can come to have their needs met through the behavioral health urgent care.
Excited about this opportunity. Take us through that. I know I asked that earlier on in the conversation, but there has to be one or two things because you've been there for a while, and
Yeah.
the other staff members have been there for a while. As we get closer to wrapping up today, what excites you the most about this new element of West Michigan community mental health?
I think what excites me, and I think what excites a lot of the team members, is just the ability to continue to expand what we have within our crisis continuum and what we can offer. And again, we want to help people as quickly and as effectively as we can. And this is just kind of another tool in our toolbox to be able to do that. And I think that's what's the most exciting is seeing us continue to build our service array and our care model, and really just provide very good quality service to our communities.
Yeah. And I was thinking as you were saying that the results ultimately is that individuals, no matter the situation, scenario, their feelings, their level of care needed, that you're able to provide as much as possible, as
Correct.
the maximum level that CMH can do that. And it sounds like this is just another step forward in that. And I don't know what the future has in store, but it sounds like CMH is constantly adding these services
Yes,
because you've determined that it's needed.
definitely. Yes. We truly believe that however we can really align ourselves with what is best practice in terms of all kinds of behavioral health and SUD treatment is what we want to do. And so part of having a behavioral health urgent care is really just adding another essential element to our crisis response.
Yeah.
And yeah.
That's wonderful. I'll leave the last response to you. Is there anything that we missed talking about that's important for you to get out to the community today about the behavioral health urgent care?
I would just say people, if people have any questions or if there's anything people want to talk further through, contact our agency, ask to speak to me, that's fine. Also, again, we will always have 24/7, 365 crisis services, regardless of what the BHUC hours are. I will say that one of the things with the behavioral health urgent care is that if the agency is closed for, let's say, a holiday, the behavioral health urgent care will also be closed.
Okay.
But again, crisis services will be available 24/7, 365. So, but please, even if you don't know if you need it, call or walk in. I mean, it really is. We want to get this out there and have people understand that it is a valuable resource for getting those needs met.
Well, we'll continue to support those efforts and get the word out. And hopefully, that are listening or watching today will do the same. And again, that 24/7 hotline, 800-992-2061. Again, multiple layers of services offered from West Michigan Community Mental Health. Ellen, thanks for taking the time with us this morning. We appreciate you diving into that, and we can't wait to revisit in the future of how well it's going and how well it's serving the community. So thank you for joining us.
Thanks for having me. I appreciate it.
Absolutely. It's 102.7 Mom FM and Hot Country Hits 99.9. It's 8:39 now. And coming up, we've got more on the way. So stick around for it. It's on Mom FM and Hot Country Hits 99.9, especially when it comes to our three things you